a long meeting as it turned out last evening, because we dealt with climate change, and we dealt with COVID-19, and this morning we dealt with relationships with Africa, and also issues pertaining to Cyprus, Greece and Turkey, and unfolding developments there. And we've reached conclusions in terms of calling on Russia to re-engage in the trialogue with the Dutch and the Dutch government and the Australian government in relation to Nphet 117, which was again that was concluded today. Last evening on COVID-19 was particularly interesting because of the consistency across the table in terms of the grave situation facing Europe now, in terms of a rise in case numbers, and again not just calling for coordination on issues like quarantine frameworks, procurement of vaccine, but also on testing methodologies and testing techniques, because some countries seem to be moving faster on antigen testing. I know it's been clinically evaluated in Ireland now following by Nphet, following the HIQUIS study on that, but I know the French are moving on that, the Greeks have moved on it, the Portuguese have, so that's, I think, significant, and that's something that we'll have to accelerate in terms of our consideration of that, because many countries think that has a role to play along with the PCR testing in terms of the future dealing with COVID-19. But suffice to say that it is destined to have a significant impact on the health, social and economic dimensions of Europe for quite some time to come. From the Irish perspective, we've moved to level 3 over 10 days ago. We had moved to level 3 in Dublin and Donegal. We've also taken a decision in terms of no visitors to people's homes, that your one household only. And it's interesting that across Europe that would be seen almost tantamount to a partial lockdown. I think we're the only country to do this nationally. There are regional approaches being adopted in certain countries. I am conscious of the advice we've received from Nphet, and I read through that this morning. I will be meeting with the party leaders tomorrow, and the Ministers for Finance, Public Expenditure and the Minister for Health, to give consideration to this advice from Nphet. And I know also that my officials this morning met with Nphet, met with the CMO, Deputy CMO, and Philip Nolan as well in terms of the modelling. So we're giving this very active consideration. The advice situation is very serious, and we will need further action in relation to this. But obviously the government will give this very detailed consideration, examining all aspects of this, and make sure that when we respond, it will be a comprehensive response.